Are you planning for a baby moon, but your parents are saying it is not safe to travel via air in pregnancy? Let us find out. Hello, everyone. I'm Dr. Divya Chopra, your next door OBGYN and an IVF specialist, and welcome to the 7th episode of the 100 Myths in 100 Days with Sri Veda Mythbuster series. So, in this video, I'm not just going to break this myth, but I'm going to dissect each and every small point for you regarding safe air travel in pregnancy, whether it is safe or not, and what is the safest and the best time to travel by air in pregnancy, what are the precautions that you can take, and what are some important tips that you can follow. And the most important question that my patients ask me, doctor, isn't the radiation exposure in the air going to harm my baby, or isn't the pressure difference going to harm my baby? And I'm going to specially address this at the end. So, coming to the most important question, whether it is safe to travel in pregnancy via air in pregnancy or not. Yes, if you're having a normal low risk pregnancy, then it is completely safe to travel via air in pregnancy. But then, what is the safest and what is the best time to travel via air? So, when you have completed your first trimester and when you have not entered your third trimester, that is the safest period to travel. That is between 14 to 28 weeks of pregnancy. So the next question that my patients ask me, that till what maximum time can we travel via air in pregnancy? So for a normal low risk singleton pregnancy, you can travel till 36 weeks, and the airlines will mostly allow you till 36 weeks. But if you're having a high risk pregnancy or a twin pregnancy, then the airlines will mostly not allow you after 32 weeks. But a very important point to note is that most of the airlines will ask you for a fitness certificate from your doctor mostly after 28 weeks of pregnancy. So don't forget to carry a fitness certificate, just a fitness certificate after 28 weeks of pregnancy. So then who should avoid traveling via air during pregnancy? Somebody who is having a high risk pregnancy, like uncontrolled hypertension or diabetes, or complaints of preterm labor or preterm premature rupture of membranes, or conditions like low-lying placenta, which is called as placenta previa. These are some of the patients who should avoid traveling via air during pregnancy. Now, coming to the most important point, that what are some important precautions that you can take to have a safe air travel in pregnancy? The most important point is to hydrate yourself properly, especially on long flights. And our guideline says that if the flight is of more than 4 hours, then you should wear a DVT or a compression stockings to reduce your risk of thromboembolism, because a pregnancy is a hypercoagulable state. And so the most important things you can do is hydrate yourself properly, and after 1 or 2 hours you can walk and stretch in the flight. And the next important precautions that you can take is to wear the seatbelt below your belly. Now, coming to the most important question is, doctor, isn't the radiation exposure, isn't the cosmic radiation in the air going to harm my baby? No, it is not going to harm your baby. Why? Because the exposure is really, really low. So the ICRP, that is the International Commission on Radiation Protection, states that the